In the past few days, hopes for a COVID vaccine have been rising. First Pfizer, now Moderna, and AstraZeneca have all released data about their vaccine effectiveness and expect to be approved for emergency use in the United States by mid-December. However, even upon approval, there will not be enough vaccines to vaccinate every single person in the US. In fact, Pfizer expects to be able to only produce about 50 million doses in 2020, which is only enough for 25 million people since they require 2 doses per person. So, considering this information, what is the US's plan for vaccine distribution, and when exactly will the COVID vaccine be available openly to the general public? Well, let's begin. Under Operation Warp Speed, the Trump administration purchased hundreds of millions of COVID vaccine doses from potential candidates, including Pfizer and Moderna. While the Trump administration set up the US government's access to the vaccine, it's now the responsibility of the Biden administration to determine how exactly the vaccine will be distributed. The Biden administration has set up the Covid-19 task force, which has already come up with the general plan on how the vaccine will be distributed and who will be given priority. However, specifics haven't been determined yet, as no vaccine has been given emergency authorization. They have, though, established that they will invest $25 billion to make sure that the vaccine is free, will put scientists in charge of determining the specifics of vaccine distribution, and prioritize high-risk groups. Since vaccine distribution falls under state and local government jurisdiction, they will be doing a lot of the work required, with federal guidance. The CDC has established guidelines for state and local governments to follow, such as prioritizing certain groups first, something that has been reflected in individual state plans. States are at different stages in their vaccine distribution plans, with some that have been developing it for several months, and some that have begun just recently on news of potential vaccines. Nevertheless, here's a general summary of state plans. The question that must be considered by states is who will be the first to receive the vaccine, as only limited doses will be available in the beginning. Most states have reported that they plan on prioritizing healthcare workers first, and then those at high risk, such as older people and those with underlying health conditions, in accordance with suggestions from the CDC. The reasoning for giving the vaccine to healthcare workers first instead of elderly lies in the fact that healthcare workers are in direct contact with the sick and are therefore large transmitters for the disease. Now, many states have not defined the amount of people who fall into these individual categories, as according to a report by the Kaiser Family Foundation, only 40% of states have defined the amount of people in these categories. Yet, the general idea that healthcare workers and high-risk groups will be prioritized is clear. That means that if you are an average person, do not expect to have access to the vaccine anytime in 2020 or the first 2 or 3 months of 2021. So, once the vaccine has been given to healthcare workers, essential workers, the elderly, and other high-risk groups, the average person can hope to get the vaccine. Now, considering that there are about 18 million healthcare workers, 55 million elderly people, and 55 million essential workers, means that the average person would fall in the second or last third of the US population of 328 million people to receive the vaccine. Considering that information, leading disease experts such as Dr. Anthony Fauci estimated that the average person could expect to get the vaccine as soon as April 2021 through July. So yes, right now, unless you are a healthcare worker, old, an essential worker, or any other high-risk group, don't expect to get the vaccine all too soon. Although we should probably be grateful that we are even able to get the vaccine next year, considering that vaccines usually take years to develop. So let that fact cheer you up a bit. Thanks for watching this debated video. Please remember to like this video and subscribe if you haven't already. Thanks, and I will see you next time.